Welcome back, everybody. Glad to have you here today on our first Cabral HouseCall of the weekend. We're going to dive right into today's question. So if you're new to the show, my goal is every Saturday, every Sunday to answer about 5 questions from our community. They come in probably over the last 6 weeks to 8 weeks or so. So if you've asked a question, it would have been answered if you wrote in before 5/14, because that's where we're answering questions from here today. So May 14th. So about 6-7 weeks ago. Happy to go over your question, but if you want same day answers, ask that at cabralsupportgroup.com. We're always happy to help there. And of course, if it's an order question or order tracking, that should be written in at support@equi.life, EQUI.LIFE. All right, let's dive into all the health-based questions right now on the show. First one is from Will. Will says, "Hi, Dr. Cabral. I am trying to get information on a healthy, all-natural substitute for alcohol. I've stopped drinking since I've been actively using your products and enjoying my new lifestyle. Still, sometimes I have the urge to relax in the evenings or while out with friends and family. What can you tell me about this product?" All right. So I actually know the product you're referring to. It is a relaxing based product. It comes in a packet. You mix it in by the Calming Company, and it has kava, it has ashwagandha, it has L-theanine. I apologize, I'm drawing a blank on the last one. Now, you will get you'll get calming effects from ashwagandha. You'll get calming effects from L-theanine. That's in the adrenal support. But kava is what gives you, it's not psychoactive, but it's what gives you that feeling of almost like a sedative, alcohol is essentially a stimulant and a depressant, but it gives you that altered state. That's what kava does. So kava. So you're welcome to use that product. Again, I can't give you any medical advice, medical treatment, medical cures, medical diagnosis, no doubt about it. And you might feel something there, or you can just use a kava product. Like if I want to have a little bit of that, altered state, kava is great to make as a tea. You can have it hot or cold. First time I learned about it, I was actually in Hawaii many, many years ago, and I love it. I think it's fantastic. It can make your tongue a little numb, but it can be great. It's in cans now. It's in little shots, it's in whatever, and it's all natural. It's an all natural herb. You don't want to overdo that. There can be some toxicity based effects to it, but that's when it's well overdone, many, many days. Okay, but what do? I just use CBD, to be honest. 2 soft gels of CBD oil is what I'll use. That's what I enjoy. Gives me that relaxation effect, or a CBD anything is helpful, but I love kava too. And so hopefully that's helpful, Will. All right, Kristen's up next. Can you speak to some ways to support a child who's 11 years old who has type 1 diabetes? My daughter was diagnosed 3 years ago with autoimmune type 1 diabetes. I've looked into stem cell therapy as one option to restore pancreatic function, and several of the protocols include an IV detox prior to the therapy. Some of them can be done with children and others cannot. I would love to help her body every way possible, but it seems options are often limited for children. What can you do to help her bodily function optimally? All right. So again, not providing medical advice, medical treatments, medical cures, medical diagnosis. Now I'll stop saying that. So all I can do is basically say, what would I give my daughter advice-wise if she had type 1 diabetes? So I would say we're going to do a heavy metal detox. And again, all of these can be done for children at stephencabral.com/shop. Takes you over to EqualLife. All the formulas I formulate are there. There's a children's protocol, right? So it's a children's dosage. So you don't use the same dosage as an adult. Use a children. We give you the children instructions. Okay. So I would do a parasupport protocol. Then I would do the heavy metal protocol. If she does not need any gut-based issues. If there are gut issues because you ran the Candida metabolic and vitamins test and or food sensitivity, then you would do the parasupport, then you would do the children's CBO protocol, then you would do the heavy metal. So why are we doing that? Well, we're emptying the rainbow. We're getting the body as healthy as humanly possible. And then if it was my 11-year-old, which my 11-year-old is on these things, I would have them using some omega-3s, 2 of the daily activated multivitamin. What else? You could use magnesium or balanced zinc, like 3 times a week, magnesium more if they needed it. You can use the calming magnesium powder if you wanted to. My daughters don't use the daily digestive enzymes if they need it, but they certainly use the gluten and dairy enzyme when we're having gluten and or dairy-based meal. Yeah, or they can use the daily nutritional support. So if they have a smoothie, they do that. If not, then they get multivitamin at dinner. All right, so that's kind of the basics right there for overall health. And then if you decided the stem cell therapy was what you wanted to do to try to return normal stem cell function of those alpha cells in the pancreas, you could do that. It's starting to get better and better. Hasn't been done consistently right now. It is still experimental. It is not a done deal. Has it happened? Yes. There has been one case that I have seen. Now, there may be more since then, but one case absolutely did work. So then with my 11-year-old, if they had type 1 diabetes, what I would do is I would get them on a consistent meal plan, about the same amount of carbs, protein, and fat at the different meals that they're having. And then I would use the right amount of insulin for them. And if they're not great with insulin, then you might look into insulin pump if it's even able to be used with 11-year-olds. And that's how I would monitor. That's how I would use it. And that's how I'd monitor it for healthy, balanced function. All right. So hopefully that was helpful, Kristen. Patrick is up next. Patrick says, hey, doctor, I just listened to your podcast on kidney stones. I believe you mentioned before that you could do a shot of olive oil and lemon, but you didn't mention it this time, if still something you recommend. Thanks. Oh, okay. I see what you're saying. So Patrick, that was actually for gallbladder stones. There's a whole liver and gallbladder flush. All right. So you can find that by typing it in at stevencabral.com/podcast. Just type in like amazing liver and gallbladder cleanse, and that will come up. That's a 1-page PDF printout. And then kidney stones was the kidney stone episode that I did. And if you have kidney stones, you can just type in kidney stones at stevencabral.com/podcast, and you'll find kidney stones. If you ever can't find a show, just ask. Ask at cabralsupportgroup.com. We'll find it for you. All right. So hopefully that was helpful, Patrick, because they're two different things. And then Andy is up next. Andy says, hi, Dr. C. We love all you do. Thanks, Andy. Post-jab in 2021, and almost immediately, I developed burning all of my body, which has now culminated in a diagnosis of small fiber neuropathy and POTS. Perhaps the worst symptoms has been my intolerance to exercise in the form of rapid heart rate and headaches post-exercise. I know where you're coming from. I used to have POTS myself. I have had done all types of functional medicine tests, including stool tests, organic acid tests, mold tests, and listened to your POTS podcast. Nothing major ever shows up. I did your mold protocol, which helped some underlying gut issues. I have qualified for IVIG treatment. Do you suggest running the Big 5 or proceeding with the IVIG? And do you have any views on long-term effects of IVIG? I'm a healthy 33-year-old, used to be distance runner before all of this. Love from down under. Yeah, always happy to answer these types of questions. And before we move on to the next question, just give you your answers here. So I do not use, nor do I typically recommend IVIG. So people who are not familiar with IVIG, it's intravenous. So the IV is intravenous, and it's immunoglobulins. So basically you're putting essentially white blood cells into the body. This can be sometimes standard conventional medicine treatment for viral-based issues such as Epstein-Barr virus or other issues where you need to ramp up white blood cells, okay? Because a lot of people with Th2 immune dominance who have had maybe Epstein-Barr or other viruses typically are chronically low, especially in secretory IgA. So here's the issue. There are many people who, after getting what you got, have very high levels of antibodies. And I worry that doing intravenous immunoglobulins might create more and more inflammation because you have more white blood cells now in the body. Again, I can't provide any medical advice, medical treatments, medical cures, medical diagnosis. All I can do is what I know works in clinical practice. And I know you ran all these labs, but there's a difference with who you're working with as a practitioner. That's just the truth. When you work with an integrative health practitioner, level 2 or level 3, or our Equalife team, you're working with people that they've seen these things before. They work as part of a clinical team. They bounce ideas off of each other, and they have specific protocols that they do, right? So just for you, like you did the mold protocol and you said it helped your gut. Yes, it's going to help your gut. But the problem is you're supposed to do the mold protocol after you do the CBO protocol while you're doing the CBO finisher. So there's a method to the madness. There is a way that the body heals, and we heal the body in foundational based orders, like heal the gut, seal the gut up, work on the immune system with the mold that still might be there, work on heavy metals. Like you're working all these things while at the same time balancing the adrenals, balancing stress, balancing sleep to help with POTS, rebalancing sodium, potassium to help with POTS, balancing calcium, magnesium to also help with POTS, which is postural orthostatic tachycardia syndrome. Basically, it's people get rapid, irregular heart rates, almost like panic attacks when walking upstairs, which used to happen to me just with that accelerated heart rate, or dropping your head below your heart, or with exercise. So I totally get where you're coming from. I was able to get rid of that, and I know that you can as well. All right, so hopefully that was helpful, at least to get started. Let's get back to our next question, and it's from Kim. Kim says, hi, Dr. Cabral. My 13-year-old son has HSP, which is inflammation of the blood vessels. That's what I gather anyway. We found out he had it after coming down with a virus and/or food poisoning. He had red dots all over his lower legs, which turns out it was due to the capillaries breaking. He has high amounts of protein in his urine. We are going to meet with a specialist for it, but I was wondering if you could help me figure out what supplements to have him take. They're probably going to want to put him on a small dose of blood pressure medication to relieve some of the stress on the blood vessels, but he doesn't have high blood pressure. I know there are things I can do to help his body, but I just don't know what that is. Any advice for me, for my child, I would really appreciate it. All right, happy to help. So he's kind of at that in-between age. He's 13 years old. If he was 16, I could give him a lot of the adult-based things like the citrulline malate, the ornithine. I would be careful about using things like L-arginine because it can increase viral-based issues like herpes. But there's so much that we could do if he was just a little older, but not at 13 years old. We have to be a little bit more cautious. Depending on whether blood thinners are a good idea, we would, of course, use omega-3s. We would use a product called Hist Pro. Again, I'm not giving medical advice. I'm just saying what I do for my 13-year-old. Hist Pro, I would do that 1 or 2 capsules 3 times a day, which has quercetin, stinging nettles, that helps with blood vessel as well. I would look at 3 specific herbs: horse chestnut, hesperidin, and what is the last one? It's in the vein-based formula. Horse chestnut, hesperidin, and I never look things up while I'm doing the show, but I need to look this up for you. And I don't know why I can't remember it off the top of my head. Every once in a while, it does happen, and we need to do it. I am very human. All right, so let's see if I can figure out what that third one is for you. But again, I don't want to just give these willy-nilly because I don't know exactly. Butcher's Broom. How did I forget Butcher's Broom? But I did. I forgot it. So there you have it. Those are the first ones that I would look at, but I would also want to understand this more because we have to be careful with overdoing these things. They're usually temporary. So the body is going to be able to then work on, is again, anti-inflammatory diet, cutting out the things that would be more inflammatory, maybe like the cow's milk dairy for right now, maybe the gluten for right now, and then just doing, again, more anti-inflammatory diet, fruits and veggies and omega-3 based foods. All of that can be great. And then looking at balancing the immune system with good vitamin C, vitamin D3, the Hist Pro, maybe even zinc could be highly beneficial. And then I would also look at the specialty ones like the Inflammasoothe, which has the curcumin and the ginger. All of those things help with inflammation in the body, and that can be really helpful. So again, you'll want to work with your doctors because if there's protein in the urine, that means there's tissue breakdown, right? Muscle tissue breakdown. And so we want to make sure that it's not overloading the kidneys because that means there is a lot of damage being done. So we don't want to overdo 13 years old. If it's a healthy child, this will begin to heal, but we also, again, want to be cautious. And I would say that, we're going to go with natural. And then if we need to, again, if this is my family, we'll look to conventional medicine as well. So hopefully that was helpful. I appreciate everybody writing into the show. And of course, I'll be back tomorrow answering more of our community's questions. Take care, everybody. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.